Hello, everybody. We're going to be talking about health promotion and wellness and how different factors come together to work against or for this objective. So, we'll be talking a little bit about Healthy People 2020, which is a government initiative that establishes and implements health objectives for the nation. We'll talk about mind body connection, the aging process, stress, and so forth. So, life expectancy is really more than the number of years an individual lives. Um, Certainly, over the centuries, expectancy for humans has increased as modern medicine has made advances. So much of understanding now is helping individuals to avoid common pitfalls before we had the understanding that medical science has provided. Uh, Paradoxically, the biggest cause of death, despite all of this knowledge that has been obtained, uh, the biggest cause of death is caused by lifestyle choices, unhealthy lifestyle choices, as we've discussed. And so, even though we understand far better the dangers of, for example, smoking and poor diet decisions, that's sadly kind of the biggest cause of mortality in the world, especially in the United States. Um, so we are only 19th in life expectancy comparing ourselves to other countries with greater than 1 million population. And so, once again, in our allegedly advanced United States, it's a sad commentary that we are 19th in life expectancy. Um, so, even though we have this knowledge, people are not using it adequately. We rank 22nd out of 23rd industrialized nations in healthy life expectancy, and Americans spend twice as much on healthcare as any other industrialized nation. So there is a lot of opportunity for progress. And as you've heard me say many times, we as doctors of physical therapy have a unique voice in our communities. And hopefully, one of the overarching objectives of this HPW course is to increase your awareness of the opportunities that are yours as healthcare providers. And so I really encourage all of us to be involved, to make a difference in our community uh, through service, and but then also real specifically getting involved with initiatives and activities that can educate the public about the benefits of exercise and the detriments of uh, poor dietary choices and so forth. So this overall health, we've talked before about the wellness being a multi-dimensional, multifaceted uh, issue, and same with this. When you look at kind of our, I guess, healthcare system, we have invasive procedures like surgery, we have medications like pharmaceuticals, and most importantly, we have individual self-care as far as the choices an individual is making that help or harm one's health. So this is from that Healthy People 2020. You can Google that and go on the government website and see these indicators and these efforts. But obviously, there are some things to enhance, such as physical activity, and then other things to minimize, such as harmful lifestyle choices. There are other things that are perhaps out of uh, people's direct control, like access to healthcare, maybe the environment in which they live, and so forth. But these are the leading health indicators. And trying the kind of the purpose of the Healthy People 2020 initiative is to heighten awareness, educate the nation, and then to hopefully facilitate some of this collaboration. So within a family, individuals can work together to improve health and make good choices within the community, and then on a nationwide level, all of these factors can come together. And then you have mind, spirit, and body holistic health. And, as physical therapists, some of us will be very involved with this and have this be an important aspect of the care that we provide. And there's a lot of research to really indicate the benefits of this awareness and kind of healing ourselves. We'll talk a little bit later in our lecture about stress and how pervasive it is and the negative effects that it has. And so a lot of holistic medicine is seeking balance and seeking to minimize negative influences and optimize positive health experiences. Some of you may have experience with osteopathic or naturopathic physicians, and sadly, we don't have a real interactive class this time around, but these individuals can make a tremendous difference in the health of many of our patients. I've seen many patients over the years who had been or were at the same time receiving care from a naturopathic doctor. These are some examples of some of the interventions that may be part of holistic treatment. So some of these, may relate to our physical therapy plan of care. We may teach our patients about relaxation techniques and breathing techniques and so forth. So there's a lot of very powerful influence that many of these treatments can elicit. We talked about these dimensions of wellness, that it's not just physical wellness. You guys are very well versed in this and aware of it. Exercise as Medicine is a large-scale initiative really put together by the American College of Sports Medicine. And there's another PowerPoint that's on this week's module that I encourage you to look through. And it's basically what we know very, very well, that movement and the opposite of being sedentary all have very, very powerful positive health outcomes. And then we get to stress. And so as we're talking about stress, maybe consider a few single words that you consider causes and reasons for stress. These can be very personal, individual. They can be more global. Some people talk about the bigger picture issues, such as a lot of the political mayhem that's been happening in our country, social rights. There's a lot happening in our country and in our world that can cause stress. And then you narrow that down to, a workplace. And for you guys, your studies at Franklin Pierce are rife with many potential stress causing factors. And so it could be relationships, it could be personal health, it could be so many different things that can cause stress. And it's really kind of a fact of life. There's going to be things that can potentially cause stress in everyone's lives. And so our opportunity is to try to identify those and address them and minimize them. So what reduces stress? Once again, take a minute and consider some words that you feel can reduce stress. Once again, there are some stress-reducing measures that are universal and others that are very, very personal and specific. Once again, I bring up self-awareness, I think, every time I give a lecture in this class, but knowing ourselves, knowing personally in our own lives what causes stress, and knowing personally in our own lives what is effective to reduce stress should be a lifelong pursuit and truly can lengthen and increase the quality of our lives. So this term of stress was first kind of appearing in the literature in 1951, and basically, this sympathetic response that occurs, adrenaline, cortisol, and other stress-related hormones are all part of quote-unquote stress. And there is individual situations that happen that cause stress, but then there's chronic stress. And obviously, chronic stress, when it's cyclical and repetitive throughout an individual's life, can really have long-term negative effects. And so job stress has often been identified as the number one stressor. There's been a lot of talk and research about social media and this whole change in our culture that's happened in the last 20 years. And so your generation, your children's generation, the world in which they grow up is very different from, say, 100 years ago. And there are a lot of benefits to technology and social media. There can also be a lot of isolation and decreased human personal interactions, which can all increase stress. Oxidative stress is kind of a process that happens in our body, and they've done a lot of research to show how breathing techniques and also relating to meditation and mindfulness can decrease this oxidative stress in individuals' bodies. So you have, I'm sure, all been taught and have taught patients and will teach patients about diaphragmatic breathing and how that can really make a difference. Obviously, there are patients who have medical diagnoses that cause decreased breathing ability, and that can then lead to this oxidative stress. So for a lot of our patients, again, as kind of a holistic approach and as part of our plans of care, we will teach patients the importance of proper breathing techniques, maybe while they're exercising, while they're going through a painful situation, while they're recovering, and that can certainly help with this stress reduction effort. A lot of research has come out of Stanford about the power of kind of controlling one's bodily functions with our thoughts and so forth. And so if that's an area that's of interest to you, by all means, look into that. And breathing techniques, meditation, mindfulness can cause a relaxation response and can kind of turn the tables on these stress cycles that can be very pervasive, and the ability to use meditation. And once again, meditation in many ways is a form of self-awareness. We are aware of our breathing. We're aware of our personal space and the thoughts that come across the stage of our mind, and we observe those thoughts instead of being subject to them. And that can really be a powerful learning technique to kind of control some of these negative influences in our bodies. So mind-body skills, there's a lot of different techniques that can be used to basically gain or improve control of our mind, of our thoughts. You know, we've talked a lot about this with practical exams and managing and controlling stress and anxiety so that you can perform the way that you need to. And of course, all these practical exams relate ultimately to patient care. So this whole journey that you've already had quite a bit of experience with in your DPT studies really relates to not only gaining knowledge, but then controlling how you implement that knowledge with your patients. So hopefully this lecture gives a little bit of insight into some of these negative, potentially negative impacts that we all face, and some of the ways that a holistic approach and mind-body awareness skills can improve that. So we have one more lecture about tobacco, alcohol, and drugs, and we'll go to that next.